Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of Kidney Coach, Kidney Disease Solution, and our supplements Kaigenesis. And I am very excited today to be joined for the first time by the beautiful, amazing Stephanie Modavis. Now, Stephanie is such a, look at her, she's drop dead, stunning, gorgeous. But Stephanie, believe it or not, has been through 2 kidney transplants, and she just has such a wealth of knowledge. And she's super passionate about holistic healthcare, coaching, and how to navigate the journey of healing after, before, and moving through things like autoimmune diseases, kidney failure, and then and I'll let Stephanie share her story, but she's been on dialysis and then the heartbreak of a failed transplant and having to go through it all again. But what I really love about Stephanie is that her resilience and really what she's cultivated through her journey to come up with strategies and ways that really have allowed her to navigate something that's super stressful and transform it into something that she's not only used to help heal herself. And Stephanie, I think you just look like a picture of health, but also she's now taking that out into the hospital. She's working with integrative medicine practitioners, and she's really got a really strong message that I really wanted her to share on our platform. And we're looking forward to actually having Stephanie join our team to actually support people going through similar journeys. So I think what you've been through, Stephanie, and I think your passion, your resilience, and actually the model of care that you've set up and really have seen worked for yourself and now for the people that you work with is something that I'd really love to dig into. So firstly, welcome to the YouTube channel and thank you for joining me.
Thank you so much, Fiona. It's an absolute pleasure to be here. I respect Kidney Coach so much. I found you guys several years ago, and what you're offering to the community is so desperately needed. So thank you so much for being you and Duncan and all the work that everybody does on the team. I'm really happy to be here to share my story. So,
well, bless you. And it's been great to just connect with someone who, 2 transplants. And I'll let you tell everybody the story. I mean, that's no small feat to go through and come through the other side and look as well as you do, and to be, I know how active you are and all the things you do with working at a full capacity and all of those sort of things. So I think, for anyone out there that's on dialysis or thinking that, or they've been given the narrative that they have to have dialysis or go through transplant and are really worried about what that will look like for the rest of their lives, I think you're a wonderful example of what it could look like. But you obviously have really invested your time and resources and energy into educating and researching and doing that. And you come off the back of being naturally curious about natural health care and all those sort of things, and then trained. So why don't you tell everybody that's listening, firstly, a bit about yourself, and then I think what people really want to know is your journey and what you went through and all of those sort of things that make you super relatable to everybody that's on this kidney journey themselves.
Yeah, wonderful. Well, again, I'm happy to tell my story. It's a long, complex one. It started when I was 19 and I'm now 47. I'm happy to say that I'm 47. So really, when you take that into account, to understand that my journey has included 5 years of hemodialysis, 1 year of peritoneal dialysis, and then not one, but 2 kidney transplants within that span of time. And the way that I've been able to really turn my life, my health, and just my whole journey around through this process, that now I help others which is what actually I had to cultivate through my journey, because I didn't have it. It wasn't offered to me. I will say, going back to more of the beginning of my process, I was 19 years old, just graduated, entering college. I actually wanted to go into medicine, and I was a picture of health. Okay, so that's just one thing that I like to bring to the table is some people come to this journey of kidney disease through different means. Some people do have issues with taking care of themselves and learning how to eat. Most of us aren't taught that throughout school, so we have to learn a lot of these things. But for me personally, I was very active in the wellness community already. In fact, I was a trained yoga teacher and a massage therapist. So I already had this blossoming love and desire for the functional medicine, integrative space, just beautiful space. And I have to say, I am so grateful that I had a few years of rich experience with more of an Eastern medicine, holistic type of care philosophy, because when I did suddenly get sick, I was immediately thrown into the Western medical model. So having that few years of the integrative and knowing how to meditate, knowing how to stretch and eat well, and knowing a little bit about nutrition and my mindset and the power of feeling my emotions and getting into my body, I had just enough experience with that to guide me through the trenches of really suddenly going into a very severe autoimmune disease that led into kidney failure. So I was diagnosed with lupus, which is a very common autoimmune disease, misdiagnosed for a year, which I know can be common for people that have autoimmune issues, not so common now, but 20 plus years ago, very common. So I had a very frustrating year of almost coming to my own death because nobody really knew what was going on. I had all organ systems involved. And in fact, before I had to start dialysis, I actually hemorrhaged into my lungs on the table where they thought I was going to pass away. So this was when I was 23, 24. So not the life and the journey that I expected, especially with somebody who was so invested in my well-being, right? I was very confused and I felt very betrayed by the man above. Like, I'm doing everything right.
Yeah.
How all of a sudden do I have this surprise autoimmune disease and I'm literally on my deathbed? So I went through a bit of a reckoning in those years where I was struggling with the autoimmune disease. I was in and out of the hospital and about to start dialysis. I was a bit resistant to get the biopsy because I was determined that I could heal myself.
Yeah.
Was determined.
I get that.
And, ultimately I had a profound surrendering I had to do because I had to just trust that somehow my journey was going to mean something. Somehow me going through what I didn't want to go through was going to produce something profound, which it did. Right.
So I love that. I'm sorry to stop you there because I think that is such a key part of healing, isn't it? It's finding the meaning in it, or making it bigger than the suffering. So sorry to interrupt you. I think that's such a big gem that people could hear.
Yes. And in the wellness space, that is the goal. The goal of the wellness space is to be extremely preventative. And I am all for that. I really love that. And that's also missing from the medical model. So that's why I love what you guys do so much. So me being a holistic health coach myself and doing my work, I thought, I'm determined I'm going to fix this. At the time, now looking back, I realized that profound amount of resistance was something that I needed to lean into instead of run from. So my doctor was kind of, calling me like, please just get a biopsy. Let's not wait. Let's just see what's going on. So that's when I realized my journey was not going to go the way that I had hoped that it had gone. But I had to let go. So right away, I was getting a profound lesson with my mindset. And, I had a little bit of distrust with the Western medical model. I'm not going to lie. So I was more of a natural type of girl. So I didn't really want to go into this space, but I had to let go and I had to trust my journey and just believe that it was going to, I just kept saying to myself, this is going to turn around and mean something to me. I don't know what, I don't like it, but I have to let go. That was really the initiation into me understanding that my illness was not just physical. It was emotional, it was mental, and it was spiritual. And then I started to realize, I understand how the training I had previously is going to follow me along this journey within the Western medical model, because as we all know, unfortunately, we're still at a point where they very much leave out the profound connection of the mind and the body.
For sure.
Right. So I was fortunate to have that experience, but the next 5 years was very difficult for me as my health continued to decline. There was nothing I could do personally any longer that was going to try to reverse things. And there was a constant surrendering and, just going to those places that I didn't want to go. But once I let go and I really surrendered, I really had to really look at the Western medical model, from what they were teaching me and telling me to do, and also try to keep in my mind while I was getting sick the profound nature of the integrative side of it, because I kept getting conditioned out of it. In fact, I did have a rheumatologist say to me, Stephanie, I know you're all into holistic medicine and you do yoga and you're a yoga teacher. None of that's going to help you now. And
Mm.
it was like a stab in the heart. And I realized this doctor, this medical professional, does not have experience in the comfort and what the holistic community and offerings actually give me. Maybe they're not fixing my body right now, but there's other elements to the holistic community that are keeping me afloat mentally and spiritually.
Yeah.
Right. So I had to forgive him. I fired him.
So I've fired many of my neurologists for exactly the same thing, so I get it.
I had to fire him lovingly, and understand that I was going to be on my own with how I integrated my holistic experience with my kidney disease. But it was
Mm.
very important for me to keep doing it. And at the height of my physical breakdown was right around when I started dialysis. Anybody that is listening who has kidney disease and they do end up going on that journey of dialysis, you have to get so incredibly ill to even really be put on dialysis or be eligible for the transplant. So there's a very scary period of time where you are extremely sick. I mean, the hemoglobin is you're barely moved. It's just you're very sick, but that's what it takes for them to start treatment on you. At that time, I remember I would sit. I felt horrible, but I was in very deep surrender, right? And I remember closing my eyes, doing my breathing practices, and I would visualize my yoga practice in my head. I did not have the strength to do it. I barely had the strength to make it to the bathroom. But I would sit there several times a week, just like I was teaching or going to my yoga practice. And I would picture in my mind's eye my body doing the movements. And I would constantly picture in my mind's body a healthy body, a person who was still able to function the way I wanted to. There were times where I couldn't walk into the grocery store and I had to have friends and family go into the grocery store. Sometimes I'd close my eyes and I'd imagine myself walking healthy into the grocery store. So I pretty immediately picked up on this. If my physical body is suffering, I am going to strengthen and optimize my mental health. And I'm going to use visualization and still do everything I can to keep my mindset strong. So for anybody who's watching, if your physical body is breaking down, it's a perfect time for you to go into the emotional and mental components of your condition as well and try to strengthen that part so you can give your body the rest. So many patients that I know get so overwhelmed with the process of being in the hospital, the process of physical illness, that the recurring situation that I see is that we get in our head and our thoughts and we can get very stressed. We're in fight or flight a lot, which doesn't really contribute any better to the condition that we're in. And we just get caught in like a loop of stress, which is totally normal. But I kept trying to counteract that because of my previous knowledge. So when I could feel the stress, I mean, I had to feel it, I couldn't disassociate from it. But whenever I could see that I was stressed, I would try to sit down and say, Stephanie, this is where you're at right now. You're not where you want to be, but you have to make peace with where you're at right now, and things are going to change. So that was a huge component and strategy that I had at some of my sickest moments.
And do you think, that whole surrender piece, I'd love you to, in my mind, I'm thinking, do we do a whole just different podcast on that? Because surrender in itself is quite a concept for people to get, because I think, firstly, I think people associate surrender with giving up, but it's not. So I'd love you to speak to that. And then, I'd also love you to speak to you're obviously very good at self-advocation, right? So I think often what happens with patients are they don't have that ground that you had with the, being into yoga and meditation and a healthy lifestyle.
Mm-hmm.
So how do you get to a point where you feel strong enough in yourself, like you fired your rheumatologist, right? And I fight three urologists until I found one that, and it's not that and I'll let you talk to your journey. It's not that I was looking for someone that was going to tell me what I wanted to hear. It's not that, but I wanted someone that at least was supportive of my ideas and my beliefs.
Yeah.
But was also knowledgeable enough to say, well, maybe here's what you need to do here. But yeah, you're right. Here you could do that. Like I wanted a partnership because I'm obviously not an idiot, right? So talk to me about those two things. So I think they're things that I think people don't advocate for themselves because we hand our power over to someone else. Yeah. And then that whole concept around surrender and how that isn't enough.
Yeah. So I think those are critically important topics. They really are. First, the advocating for yourself. I will say that this was in the beginning when I first started my journey and I went through the first process with kidney disease and the failure and transplant. There was a period of time, probably about a year, where I did lose my autonomy. It is something that when you are sick and you get news like that, it is shocking. It's shocking. So when I went in, there's this immediate transfer of energy where you feel like you're at the behest of the provider and like you have to just do whatever they say because your life depends on it. So there's some sort of transference of energy when you step into the hospital system and you are that sick where you're depending, you're desperate. So it was a little messy at first, but I learned very quickly that if I just surrender myself, and I had some physicians who were challenging my autonomy, like the gentleman who said, don't do that stuff anymore. I started to realize I need to be a part of this journey. And if I don't find my voice, they will happily decide how my journey is going to go for me. And I started to meet other patients, especially on dialysis. And I really realized that there was an epidemic of people claiming their autonomy and partnership with the experts and the providers. I could see it playing out. And again, because of my history, I was like, wow, this is kind of like almost like a victim savior type of dynamic happening here, right? But it's so deeply, it's kind of hidden that it's hard to be aware of unless you have education on those dynamics. But I started to see that if I don't stand up for myself and start being myself in these appointments, and of course it's pressure. You got 10 minutes, you got to have all your questions, your medication list. So it's like, when do I have time to be myself even, right? So I started to just commit to show up as myself. That I would say anybody listening, the first thing you can do before you advocate for yourself is just make sure you're being yourself in your appointments. You know, when I would talk to my physicians, I said, look, I need to establish a relationship with you. How are you? What's going on? So I kind of made it clear that I wasn't going to accept anything other than actually having a relationship, a friendship with my provider. And, you know, I was young and I was very sick and I was charismatic. So they wanted to help. So that was very important. If you can't be yourself, or you don't have enough time, it doesn't feel equal, right? It feels like it's very hierarchical and you're just getting a service. And if that's how you want to go about your care, by all means, they will be happy to do that because I think that's what they're used to. But I would suggest everybody listening to the call, the first thing you need to do is you really need to be yourself, which, you know what I learned, Fiona, when I made that commitment to myself, there was a lot about myself that I didn't know. So it really opened up a lot. I thought, if I'm going to be myself, well, who really am I? How do I really need to speak to these people? Like I have to fully be myself. So using your voice and not being afraid if somebody in authority, if you need to say, this is not working for me, please don't be afraid to change doctors. It doesn't have to be an argument or aggressive, but you have a right to see your provider as an equal. It's a service. It's also a transaction. They want to help. But unfortunately, I think the Western model in particular, I don't know how it is in other countries, is that the providers have gotten so used to taking care of individuals rather than them stepping up to claim their self-responsibility and autonomy within it. And to me, that feels like the profound distinguishing factor between functional and integrative medicine and Western medicine, is that one takes care of you and the other one wants you to take care of yourself, and you collaboratively work together.
I think that's a really good distinction. And when people are really sick, sometimes people just want to be taken care of,
Right.
But I think in that, you give that power away. And I always say to patients, no one is an expert on your body but you. You know it inside and out. And there is these gut intuitions and feelings. And, specialists might say something and you might be like, that just doesn't feel right. And it's those moments that I think it's really important, because, if I'm working with anyone, I always say to them, never put me in a spot where you think I know your body better than you. I don't. So if I ever say anything that just you're like, not sure about this, or that doesn't quite make sense, I'm like, you tell me. I will never, ever override an intuition or anything like that, because you live in that body. I don't. You will always, you are the absolute expert of your body. No doctor, no matter what PhD and qualifications they have, will ever know it better than you. So I think that's a really good distinction to make.
Yeah. And that is, again, it is still, there's a gap, a schism between what you're saying and what many of here in the West providers, they will assume that they know your body better than you. But what they're referring to is clinically. They're referring to the clinical process. They're referring to, actually, they do know parts of my body better than I do. Right. But there has to be that awareness that we keep discussing, is that, yes, you may know how my body works functionally, mechanically better than I do, but we have to value the gut instinct, the intuition, and the feelings. And that's something that I profoundly advocate for now, is helping providers understand that their patient's going to have a better experience if you honor how they feel.
Yeah, I think that's a great point. And then take me to the surrender part of this, because again, you're talking and people are like, okay, so I need to advocate for myself, but then there also is this point of surrender too. So they sound a little contradictory, right? So walk me through that, because I know for me, that also has been the toughest part of my journey, is that surrendering in, like you, very similar, healthy, grew up on a biodynamic farm. How do I end up with an autoimmune disease? Like, I totally get that story. So walk me through that part, because that's, for me, has definitely been the hardest part of my journey.
Yeah. I'll go right to the point. I think that the surrender part of it is very spiritual. And because there has to be a level of something transcendent that allows you to surrender. And I didn't realize, because I was a yogi and I claimed myself to be this peaceful, person. But when this happened to me, I realized that, wow, I'm a little bit of a control freak. Right? Like, okay, this is how I like things. I want things to be done this way, and that was something that I really had to face within myself. I thought, oh my goodness, like, I actually am a little bit of a control freak. And I think that a lot of us are. We don't realize it, but we want things done the way we want things done. And we don't like interruptions, especially a diagnosis of kidney disease. That is a massive life interruption, right?
Mm-hmm.
So I will say that I have not mastered surrender, but I realized that if I kept fighting what was, I wasn't going to survive. So up to this day, when things happen that aren't exactly the way I like it, and obviously things happen to all of us, I take a breath, I take a moment, and at least I have the awareness. I don't like this. This is not what I hoped for. But what choice do I want to spend the energy to fight it or resist it or complain about it? Or do I want to utilize my energy in a more positive way? And that's what happened when I got sick, was that literally I had no more energy. I had zero energy, which meant that I'm not talking about just physical energy. There's different types of energy. I had no mental energy. I had no emotional energy. So if I was going to fight something in my head, it was going to take energy. We all know what that's like. When you're stressed, you feel tired,
Yeah.
It affects your body. So I didn't have a choice, really, Fiona. It was like, you either let go and ride this wave, or you're not going to make it. Like you don't have any, you can't fight anything anymore. So it was, I think I was pushed into a corner. And it's something that now I've learned to at least create awareness around. So, which means I'm aware when I want to fight something and not surrender to it, but at least that awareness helps me to reframe my feelings about it.
So now walk me through the next part of your journey, because you obviously went through one transplant and then a second one, which I can't even imagine what that would have done.
Right.
You know, you're like, I surrendered, I got through this, and are you kidding me? I've got to do this again. So that's a whole new level of, but I guess you were more well prepared. So what did you do the second time differently from the first time, that you think, what had you learned where you're like, this is what I'm going to do this time that I didn't do? Did you have a sort of like, okay, it's got to be done differently or anything like that?
Yeah, so that's a great question. I want to be very transparent for the audience watching about my experience. If somebody does go the route of kidney transplantation, it has different lifespans. The kidney has different lifespans in different bodies, and it depends on the underlying conditions, right? And also, unfortunately, the current medications that they offer are nephrotoxic. So it's a very confusing ball of wax that patients are dealing with. So during my first transplant, again, I'm the type of person who innately is going to want to do everything perfect. And honestly, probably one of my greatest lessons, just a tiny little side note, is that I realized that I had, very severe people pleaser tendencies and perfectionistic. And that was a part of the things that had to change within my process. So, but when I got transplanted, I went back to like, they'll tell you, okay, you can eat pizza now, you can have potassium, you can have phosphorus. And I was like, okay, yeah, once in a while, but I got to be healthy. And that's something that I don't see as much as I'd like within the patients who've been transplanted. There's this, okay, go live your life now. Do what, here are the rules, take your meds, but nothing else. Unfortunately, I meet a lot of transplant patients who don't have a healthy diet. They become very overweight. They become very depressed. And I'm thinking, well, wait, we missed all the part about you have to still integrate health and wellness after your transplant. It's critical. Right. So, yeah, so definitely, when I had the news that the kidney was starting to not function as well, that started with my blood pressure going up a little bit. What had happened was I had recurrent urinary tract infections, just the way my body was, the kidney is very close to, the bladder and the ureter, the way that it's transplanted. And then in addition to the medicine, they think that they had given me a little too much, that might have also been contributing to the vascular issues and the things with the failure of the transplant. But yeah, nobody ever wants that news, because then you're like, okay, here we go again. Right. So just for anybody listening, you don't want to go through one or two transplants, but I am here to say that you can get through it and come through it even better. It's just going to be a heck of a journey. So what I decided, there was nothing very specific that I decided to do different, because I felt as though during my first run with my transplant that as so far as exercise and nutrition, I felt like I was doing a pretty good job. In my heart of hearts, I felt like it was partly the medicine. I didn't stop taking it. Of course, you have to take the medicine. But I felt like that could have been doing some damage along with the urinary tract infections. And again, it was a little bit of me being compassionate to myself and not trying to beat myself up and say, well, you could have done this better. It was like, Stephanie, chill with the perfectionistic tendencies. Maybe this is just something that was out of your control. I know that you'll be aware if there's something you can do better. So just relax and let's ride this wave again. But I will say that through the second one, I just have a slightly different commitment in my attitude. So I've realized that you can't, most likely you're not going to continue to get transplants. So it has run through my mind, Stephanie, you got to live your life as if every day were your last now, and you could go another 20, 30, 40 years, but the things that you're not doing and the person that you're still afraid to be, you must become that person. So it really challenged me to go deeper into my self-worth and really say, what did you come here to do? And you have to be bold enough to challenge the narrative and to step out there with your message. And my message is a little confrontational for some traditional providers, but I've committed to myself. For the rest of my life, I have this beautiful commitment to not just the goodness of transplantation, which it is good. And the Western medical model, everything is transplant. But my commitment is to truth and goodness. So I come with the other aspects that I feel are needed and missing and lacking. And, certain providers know it. Other providers don't know what to do about it because, again, we're still so connected and we're disconnected in the West from the mind, body, holistic Western model marriage. So that's the goal for the rest of the time that I'm here, is to really try to push the message that the holistic care and the mental and the emotional and anything integrative you can do must be coupled with your kidney disease and your transplant experience.
What a beautiful message, and what a great way to reframe what your experience and what you're going through, to give yourself purpose and meaning, which is just
absolutely a
whole other level from being a victim to what happened to you. So for people that maybe have kidney disease and have been told they have to do dialysis and transplant, I mean, you've got so much information. We will definitely have you back, so we will dig into a lot of these topics. But what I really want to know is, what are the things that you can see, because you're working with people going through this all the time, that you go, that makes the difference, or they're the key things to have a healthy, good experience of a transplant, or to avoid dialysis, or to hopefully, and you're right, transplants will fail, especially in autoimmune diseases. Sometimes we can't help that sort of stuff. But for people that maybe don't have that, what are the things that you see going forward that you wish people with transplants were told if they don't get to meet you?
Yeah, thank you for letting me share that. And that's, I'm happy to share. This is not just from my experience, but really the research that I do in the field and the people that I talk to is some really crucial tips would be to realize that what you're going through is temporary. Okay. So what you're going through is temporary. So do your best to surrender and relax. You want to try to do everything that you can as far as diet. You want to continue to try to move. If you're struggling with depression or anxiety, it's always nice to talk to a peer. A lot of times patients feel very lonely. You're definitely not alone in this community. This is unfortunately a formidable community. So you're not alone, but also to know that this is something that if you do feel depressed or anxious or overwhelmed, I think it's normal. Give yourself a little self-compassion. But other things that I find that are very, very critical are, besides a little bit of movement still, try to making your center, try to do things to help contribute to de-stressing yourself. But the quality of your relationships. I can't tell you how many times I meet people and they're not being honest in their relation. They're not being honest to their doctor. They're not being honest within their caregiver relationship. There's troubles in the marriage, or there's, familial dynamics going on and fighting and tension that are happening around when somebody is ill. When somebody's going through this experience, I've discovered a lot of us have been putting other people before ourselves. So when you're going through this, you must put yourself first. And if there are people that are stopping you from your self-care in this moment of being critically ill, you need to reevaluate communications or advocate for what you need. I will say that one of the most powerful experiences I had was I had a family member who there's a lot of tension between her and I within my life, as is my mother-in-law. I hate to call it out, but we all know that dynamic can be complicated. But I had asked her every time she would try to, come see me when I was in the hospital, I had to say to her, I had to find the courage to say, your presence doesn't contribute to my wellness right now. I will let you know when it's okay to come visit me. I had to continuously take back my power in my relationships and advocate and speak up for myself when I felt uncomfortable. I couldn't be a doormat. So I would say you need to be around somebody who's supportive. You don't need to be around 10 people who aren't supportive. You need to have one person in your life who's got your back, who you can really be authentic with. And also you want to advocate and find the right doctors for yourself. So I think those are some practical tips that are really important.
Amazing. And through everything you've been through, tell us more, because people want to know, what are you doing now? How, because you're in this space and you're really taking everything that you've been through and working with people. So tell people that are listening more about that. What does that look like, of how you have seen, well, what you spoke about before? You're here now to really make sure that you change and you contribute, and that's part of your life's journey. So what does that actually look like for you on a day-to-day?
Thank you. Well, I will say that when I went through the second transplant and dialysis again for a brief amount of time, and the transplant, I don't have children, but I compare it differently to saying, well, this is like having a second child as opposed to the first. You have some very profound experience. So because I wasn't as ill as the first time, I became an avid observer and researcher. So when I went on to dialysis, I was like, are you educated about this? Do you know about this? Have you tried breathing? I immediately became that person where I wanted to see what the community was aware of, and I wanted to see where we were missing the mark. Same with the transplant experience. I just started taking notes. I knew that this was going to somehow culminate into my purpose. I also will say that my years of illness and going through this experience, as hard as it was, I think it was partly educational and giving me some practical experience of the difficulty I would face trying to make these changes within the system. I had to get strong. I had to learn how to speak. I had to learn to advocate myself. I was never going to change anything in this system if I didn't have what I integrated from going through my illness. So again, when you look back, you're like, wow, I wouldn't be here today if I didn't learn the lessons that I received from my illness. So really what I do now is I have a nonprofit called Awakening Healthcare, and we work a lot within the transplant teams and with patients right now. And really what I do is I try to implement peer programs into institutions. So even though the institutions claim that they have covered and they're comprehensive in their expertise, they don't have anyone who can look you in the eyes and say, I know you, I've been through this, I got your back. So I think that peer mentorship is critical. I think it's the only way to really be holistic and comprehensive. If you don't have the person who's lived it, how can you really know? So that's what I advocate for. So on a day-to-day basis, sometimes I have phone calls and do coaching with people and peer mentorship. Today, actually, I went into the transplant unit, one here in Texas, and I talked to people who are waiting for evaluations. And the team has welcomed me as an active member of the team, and it's one of the first in the country. I think they're starting to learn that they need help, and also the teams are burdened. They're burnout. So to have somebody else who can work with the emotional component for their patients reduces burden on them too. So it's a win-win situation, so to speak. So that's what I do. I do a lot of coaching and phone calls and, help people who call me and who are scared and they don't know what to do. They don't know where to turn. And I simply just try to be a voice of love and compassion, and just try to, I just say, I got your back, whatever you need, I got your back.
I love that. So, I mean, there'll be lots of people watching this that have, been told that they, transplant might be in their near distant future. And I'll put your details in below, but you offer one-on-one coaching for people and to help walk them through the journey. And you can do that with anyone, anywhere in the world with the amazing modern technology such as Zoom. Is that a correct assumption?
That is a correct assumption. And just so everybody knows, my expertise isn't, your numbers or your lab work or the stuff that your team goes over. And my expertise isn't what you guys do. My expertise really is in the peer experience and more of like a mental, emotional work and helping people through the day-to-day challenges that they face internally with the process.
And I just think, like you've mentioned already, it's just something that isn't factored into Western medicine. It's not. And I think, you're absolutely right. There's absolute value in speaking to someone who isn't just empathetic. They're like, no, I've lived it. I actually get it because I've been through it and I know it. And it is, I know that with patients that have the same autoimmune disease as me, they're like, well, we'd rather talk to you because you actually know what we're talking about.
Exactly. Yeah, it's like the AA model, the AA model is very profound because you have people who've got through the same hardship as you, because we don't do a great job at incorporating the mind body. I mean, at the end of the day, none of us are getting out of here alive. Okay.
Sure.
So the reality is that no matter where you are on your kidney journey, you want to do everything that you can to try to cultivate wellness. But I found that during the second experience I had with this, that my body was literally dying before my transplant, but I felt oddly healed inside, like this profound relationship between my inner being and my physical being. And that's really what I'm trying to advocate for, is that do everything you can physically, please, to try to get the help and support that you need. But if you don't also couple that with healing your inner self and understanding that this is a journey far beyond the body, it's going to create more suffering.
I love that message.
Yeah.
Okay, Stephanie, I think, look, we've just scratched the surface of what I want to talk to you about. So for anyone listening, Stephanie will be joining the Kidney Coach team to offer exactly what she just spoke about. We will get her up on our website. But in the interim, before we do that, I'll put her link in below so you can reach out straight to her. But Stephanie, is there anything else for anyone listening that you would like to impart or share before we wrap up that you feel is, one of those nuggety gems that you want people to really take away after hearing this?
Yeah, I think one thing would be that remember that this is an experience. It's not your whole life. It's an experience you're having in the moment, and it has profound guidance and a message within this experience. So my main message is I don't believe in the broken body type of model. I believe that our illnesses carry profound messages and they are a catalyst towards healing. So try not to demonize the illness. In the West, often we, F cancer or F this. And I have the complete opposite philosophy, which is, why have you come to see me? What can I learn from you? And how can I work with you, not against you?
Perfectly said. Beautiful message. And it's definitely been my experience on my own journey as well.
Yeah. Yeah.
So anyone wanting to connect with Stephanie, I'll put her link in below, Awakening Healthcare. And then I think your Stephanie Modavis I'll put all those details in below.
Great.
And then we'll have a link up to our website as well, where you can connect with the beautiful Stephanie. But I think I'm so excited that you're going to join us. I'm so excited that we've now got someone that can do, because we're so passionate about that side, but apart from my beautiful Nana who went through kidney disease, I have an autoimmune disease, but I haven't been through what you have. And I think when someone has walked the path before and has come out the other side, I think there's just something in the brain where other people can watch and go, okay, there's another narrative that I can write about my experience with kidney disease because Stephanie has. And so if she can do it, why can't I? And I think that's a really amazing, beautiful gift. And the fact that you've walked through it with such graciousness and really looked at how you can then help others, I think, ultimate game goal there. And you've done that, Stephanie. So I just want to thank you for being you and everything that you bring in. So excited to see where our journeys now go together and how we can better support this beautiful community that's out there that I do think is lacking in everything that you spoke about. So really great to have you with that.
Such a pleasure. Thank you so much, Fiona.
Of course. All right. Remember, if you want more information about Stephanie, I'll put in all the links below. If you want to find out more about what we do, head to www.kidneycoach.com. You'll often find it, not often, you will also find us on Facebook and Instagram under all the same stuff. Remember to hit subscribe and like. That way you will get notified anytime we put up new content. And if there's any topics that you would like me to talk to the beautiful Stephanie about, please put it in the comments below. We will definitely have her back on and we'll do lots of podcasts talking about this side and the spiritual side. I think it's for me, it's a really important part of what we do. And I really want to make sure that we're covering that. So if there's anything you'd like us to talk about that's not what we're doing with all the other doctors and things like that, please put it in the comments and I will let Stephanie know. Steffi, thank you again. Really appreciate you. Looking forward to this journey with you. And everybody listening, thank you for being part of our community. As always, I hope you found this valuable. We look forward to seeing you next time. Bye.